just switched on recording at the moment. So what I've done is I've put together a few slides. Some of these slides, some bits of information I've taken from the BBC website, but some of the information predominantly is related, directly to the unit and obviously the assignment at some stage, so that you're able to pick out some of the golden nuggets or the important bits of information and utilize this in your assignment. Yeah. So let's look at how do you, before I start. So for example, let's look at how do we handle information. Why is there a requirement of putting, things like confidential, handle with care, these kind of acronyms that we see on the information when you're given something? Why do you think this is put across on some bits of information that we get to consume or see?
It's a person's own right to have their own kind of personal, like doctors' notes and stuff. They don't need to be shared unless necessary.
That is correct, yes. And in some cases, what we also look at is when the information is shared. So what you've said is absolutely correct. Some of the other reasons that we can think of is very basic would be that sometimes when you look at information, it is shared depending on your position in the organization or basis your hierarchy in the organization. Do you need to have access to this information? In some cases, sometimes these basic questions are also asked. So if we imagine a setting of, say, for example, a surgery, or in general, say, let's look at a business first. Sometimes you will see that the basic accounting information, which is related to companies' accounts or financials, is not generally available to people working within sales and marketing or administration or maybe in general operations. This information is predominantly privy with the finance department, and within finance also maybe one or two people who are dealing with taxation or company accounts, company secretary will have that information, isn't it?
Yeah.
So similarly, when we look at the healthcare setting, what we do see is that if we imagine an environment wherein you're looking at a GP surgery in particular, what tends to happen is a lot of patient records are dealt predominantly in the front office and by the practice manager, and in obviously some of these records are then available with the practicing nurse or the clinical nurse and the GPs. But apart from that, anybody who is outside the remit of these operations, could be people in general administration, reception in particular, looking at booking an appointment, these people would not have access to maybe the details of patient records. They might have access to information like date of birth and your address, just to confirm some security features. Beyond that, they won't have details of the medical records and other bits and pieces because they are not supposed to be having access to it.
Okay.
Right. So basically, when we look at handling information, when we look at it, involves a bit of confidentiality, and in some cases there is a legal requirement. So when you say, for example, look at solicitors or when you look at legal firms, sometimes the current scandal, say for example, the payment protection insurance (PPI) scandal, that we see a lot of banks have been asked to put money aside. Now, if you get phone calls or if you've received a phone call in the past, wherein the companies are soliciting that, did you have any loan, credit card or things like that? And what they tend to do is they say, okay, we can undertake an investigation, but we'll send you some documentation over which you need to sign. So basically what you're looking at doing is you're authorizing them as a representative or as a company for them to be able to carry out that investigation on your behalf. So what they would then do is basically, once you have signed the documentation, completed a few forms, that would mean that they have complied with a legal requirement, which has been set by FCA, Financial Conduct Authority. And after they've obtained those documents, they then write to the bank or the credit card companies to say, can you make this information available? Can you make us these statements available for a number of years? And then they go through that to see if any PPI was applied to any loan or any credit that you're taking. So handling of information and its requirement could mean that you're looking at confidentiality, you're looking at meeting some regulations, which could be a legal requirement. And in some cases, it could also depend on the fact that this information is only accessible to certain people within the organization because of their job responsibility or role within the organization. Okay. And sometimes the most key part that we look at is, why do you share this information? And sometimes when you look at promotional emails or these communication flyers or things like post, which come, things that you receive in the post, which are more to do with marketing, sales, and promotion offers. Sometimes you have a box that you check, which basically says, I opt out to receiving further information, or even, in some cases they say, I want to receive information only on email or by post or by phone. And the idea why this particular checkbox is put in at some point in time is to ensure that the information that you share with us, or the companies which are trying to obtain this information, they want to make sure that they are trying to build trust. That means, why would you trust them with certain sensitive, bits and pieces of your, spending history, or your likes or dislikes and things like that? And the idea why they look at this legal compliance is that the company who is obtaining this information is trying to build trust on your behalf, saying that, okay, we will strictly look at these records, but we will maintain, confidentiality, and also in some cases we are required to get this, because of the legal requirement and the legislation which is in place. Is that okay? Yeah. Now, when we look at information sharing, so there are two options you always look at: binary, 1 or 0, or yes or no. So do you want to share this information, yes or no? Sometimes when we see that GP surgeries refer certain kind of patients, or with the health and social care sector in particular, there are lots of clinical research and studies which tend to happen, wherein they ask you to opt in to a particular research being done. And now those studies, as you know, in the medicine or the medical areas, they are normally 2 years, 3 years, 5 years, 7 years, 10 years kind of studies. So sometimes they start off by basics of collecting information and send you kind of a questionnaire to complete. And this is where they start off with the yes or no, saying that, do you want your information to be shared? Do you want your medical records to be shared? Do you want your conditions to be shared? But at some point in time, in the terms and conditions, they clearly mention that none of these information that you are sharing with us will be shared with any third-party agencies. Yes? Yeah. Yeah? So what we look at is, we look at basically, we start off with a questionnaire, and most companies or agencies which work within this sector would primarily look at starting off with a information collecting kind of a questionnaire, and they will always ask you whether you want this information to be shared, yes or no. And once you go through that, then obviously at some stage they get into a bit deeper and then start asking you questions which could be on the need to know basis. That means this information could be shared with those individuals who need care, or for example, people who are taking care of those individuals who require medical supervision or attention. And in those cases, we call it, the information is on a need to know basis. Okay. Yeah. So there are some questions which have been put on the slide. For example, which of these people do you think below would need to know an information about individuals' care and support needs? So the first question is, without looking at the check boxes, do you think your neighbor would need to know your requirements for say, for example, health and social care or your medical care? No. No. Okay. So similarly, some of these questions, which have been put forward, say for example, a health and social care worker, or say for example, you've had a colleague of yours or a friend of yours who's say for example has a condition, and she or he requires visits which come in from the from the health and social care worker. So obviously they would need to know the information in order to provide better care, or in order to provide proper care in terms of dealing with your situation. So some of these are very basic questions that we look at, and this basically shows you to kind of understand a matrix wherein how information sharing can be done, and in some cases information sharing is done on a need to know basis. Okay. Now the other bits in terms of that we look at is how does information today get shared or disseminated? In terms of when we look at in general, there are lots of ways through which we can distribute information. We looked at in the last session that information, in some cases today is through, there are 3 different forms. You have verbal, non-verbal, written communication. Within the non-verbal, you have body language as well. But when you look at dissemination of information, we look at the various channels or mediums, and those channels or mediums are broadly classified under, the 3 different types. Social media is one such medium through which nowadays, in the, let's put it this way, in the last decade or so, because of these mediums being available, we see a lot of information currently being shared using social media. So a research agency which would have done a report, would kind of publish that report through, a press release or a abstract of that report being published on the website. And sometimes you get to see that you can consume, you can access, and you can also kind of disseminate this information using social media. Okay. But again, there are lots of laws and legislation which are currently being brought in, and these are being brought in even when we look at social media. So if you are aware, and then if you are tuned into the news, for example, you will see that in the last few weeks there are lots of bits and pieces which the government is trying to put together to kind of curb the availability of certain sensitive type of information through social media. And in particular, what we've seen is that Facebook has been in the news. So when we look at one of the things which poses threat to national security, for example, in those cases, what they're saying is that some of the accounts need to be monitored so that there is no propagation of untoward messages using, social media, because everybody can access social media and it is accessible through different platforms. So there is a lot of law and legislation which is currently being introduced in the case of social media. Basic things that we are aware of is that when you look at information sharing, for example, for Facebook account, you need to be over 13 years before you can open an account. In some cases, it requires dual verification. That means you have an email address, but it will also ask for a verification on your mobile phone by sending you a text message. So those are things which were implemented maybe 4 or 5 years back, and then there is a revision in law required on the social media side, because a lot of information currently is also shared and can be shared or grasped by agencies or companies, businesses from their Facebook accounts. So social media is one such medium through which information can be disseminated. But at the same point in time, this is also used as a medium to reach across, audiences, because it allows them to reach audiences very quickly, very efficiently. And this kind of information shared through this medium using mobile technology is easy, provides easy access in general. And, there are sometimes risks associated with this, because sensitive information can also be triggered through by sending a small tweet of 140 characters, but in that tweet you can include a link which links to a particular website where the information is stored. So this slide basically emphasizes on the fact that in sharing our information is being re-looked at in the context of rules and regulations on all sorts of mediums. So obviously we have Data Protection Act, we have organizations which deal with personal and sensitive data need to be registered with the ICO, the Register of Organizations. And here, the digital aspect is currently being reviewed by the government, because what they are thinking is that a lot of information currently is, released, consumed, and distributed through social media. So the Information Commissioner's Office, ICO in general, is actually looking at, along with certain other government departments, to see if sensitive information related to health and social care, in particular, patient records, the history should not be allowed to be put onto, social accounts like Facebook, Twitter, and a lot of other types of accounts which are classified under social media. Is that okay?
Yeah, that's great.
Okay. Now, let's look at two bits of, two important pieces of legislation, which is, one is Data Protection Act. Now, have you come across or have you heard about Data Protection Act? I'm pretty sure you would have.
Yeah. My job, I work and the people work for a couple of years. It's a bit far, but I did my MBA level 3.
Right. Yeah. So in general, the Data Protection Act basically says, whether or not an individual can be identified, from a set piece of information or data. And this information, if it is related to a person's personal records, then in those cases, this information can only be accessed, shared, or distributed with or by organizations or individuals in particular, which have some sort of, which basically have, which basically meet a compliance set by this particular act. So the Data Protection Act was introduced obviously in 1984, and it basically set some rules down for the information, because at that point in time, when we look at, we had most of the information on paper, but then there have been revisions to this act, because as we have moved more and more towards digitization, that means more and more usage of PCs and materials which actually store information. The act has also been modified. It has had amendments into it, and it basically revolves around the fact that there are certain rules and regulations which the government has formulated in terms of storage and the use of that information if it is related to a particular individual's data, in terms of personal data. So most organizations which currently deal with customers, consumers, whichever way you call them, it's a difference in terms of the usage of word. But if you deal with information which is not related to you in general, but also deal with information related to people and other sorts of, and people in different walks of life, then walks of life, essentially, what you need to do is you need to comply with the Data Protection Act. And here you need to comply by understanding what does the implementation of this act means within an organization and within this setting, when we look at the healthcare setting in particular. So you should have the basic knowledge of actually understanding how this data can be processed, can be consumed, and can be distributed. And in some cases, again, the need to know principle is applied when you are sharing this kind of data with third-party organizations or people who need access to it, other than the people who are directly connected to the person. So here, this particular act also looks at managing pieces of information. Sometimes when you collect information, that information can only be kept for a certain number of years. But after that, certain certain bits of information has to be destroyed, and it has to be destroyed safely so that it cannot get into the wrong hands. And if the act actually sets out protecting, individuals if they feel that their data has been breached, for example, or this data has been obtained through unlawful means, then it gives the rights to consumers to be able to, kind of seek legal assistance to get that data removed, or, to get that data or anomaly removed from that organization which has obtained that data. Is that okay? Yeah. So what I've done is I've put some slide notes wherein you'll be able to see some bits and pieces, like in the healthcare sector in particular. The Data Protection Act actually looks at coverage of people living in a particular area, which will include things like their names, their addresses, date of birth, telephone number, email addresses, which gives you the basic identity of the person to be able to use it, and then that can be used for fraudulent purposes. So if you have these bits of information, then this bits of information can be used to open an account, can be used to do pretty much everything for a person remotely. So this bit of information, if you have collected, things like a passport, which is an identity document, you're not allowed to have it unless you're required to have it. And if you are collecting that data can only be collected if you comply with the Information Commissioner's Office and are a registered organization under the ICO, Act. Yep. Is that okay? Yep. The second one that we look at is, in general, the Freedom of Information Act. Now, this was the thing which was introduced a couple of years back, and as basically media tries to gather information, what they did was,
with the data, you're allowed to break that, aren't you? As long as you feel you believe they're at harm to themselves or at harm to you. Is that right? Then you can.
That is correct.
Yeah. Okay.
That is correct. Now, the Freedom of Information Act was introduced in 2000, and obviously this act actually provides access to public, basically allows the publics to access information which is which is basically around the government departments. So in general, when we look at public authorities, if you have to obtain information from them regarding certain aspects, then this can only be obtained under the pretext or under the guidance of the Freedom of Information Act, which was introduced in 2000. And this allows members of public, in short, to be able to access information which is related to government departments or public sector enterprises or organizations which are predominantly funded by the government or the taxpayer.
Yeah.
Right. And here again, when we look at the additional information which we need to look at, I don't think we need to look at the acts in very detail, but what we want to be able to do at level 4 is to build an understanding of what the act is about, what it covers, and how it can be applied, or when is it applied when we are trying to look at accessing information. So under this act, what we are looking at is, if you want to obtain information, say, for example, the Office of National Statistics, or, for example, the Bank of England, these are governmental or public authorities which basically set regulations in the UK, or in general, when we say, Great Britain, because it covers the 4 countries. Here, the idea would be to understand that if you're trying to seek certain information, then you have to go under the pretext of the Freedom of Information Act. And once this information is accessible to the public, you can then go across requests for this information, and the records then can be released. Now, there are certain timelines and limits under which some part of the information which is considered sensitive information sometimes is not released within a particular time frame. So public records, for example, on the census is only released after 10 years. The last census that we had was 2000, and after that we had it in 2010. So the records of 2010 census would actually be released in 2020.
Okay.
There is a certain time limit in some cases when some of these bits and pieces of information can be accessed even under the Freedom of Information Act, because that data can only be released after the timeline has been, say, for example, has expired. So in the case of recent event, if I have to give an example, when we look at, not specifically related to the UK, but when you look at the President Donald Trump actually talking about releasing the assassination files of President John F. Kennedy, that those files have been under wraps, and some bits and pieces of those informations have been released successively after the embargoes have been lifted. So after 10 years, after 20 years. So the last files, which basically pertain to the assassin in particular, were never released, and they were considered classified. So there's that timeline is reviewed by the Parliament, or by Capitol Hill in the case of US. Their Parliament actually approves it, and if they feel that this is sensitive information, they put an embargo on it, and it cannot be released. So that timeline had expired, and he said, okay, he is in favor of having those released now to the public, nearly 40 years after President John F. Kennedy was assassinated. So when you look at sensitive pieces of information, sometimes you will feel that even under the Freedom of Information Act in the UK, some pieces of information like the census data and things like that will not be accessible even after they've been published or after an embargo of 10 years.
Okay.
Okay. Now let's look at very briefly, how do we look at handling information in health and social care? Now there are lots of information which are currently, shared and stored in different, mediums within, let's say the use of IT. So here, what we are looking at is we will look at basically picking up how do we look at health and social care workers, so HCP professionals in particular, and what sensitive measures they need to be aware of when they are trying to get access to information, say with PCs or computer-related equipment within a hospital. So here, when you look at imagine a setting wherein you're looking at patient records that you want to access in the hospital, you'll have to go through a certain number of checks before you actually get access to those records. So if you imagine that there's a patient which comes into A&E, and then they want to basically meet the GP wants to get access to the records. In most cases, when you look at certain hospitals, they have fobs or they have RFIDs in particular now, and this allows them to kind of swipe their RFIDs, use any PC within the hospital setup, and get access to that information. Now, when they try and get access to that information, if you look at the background in terms of how they go through that, would be that if you're getting access to the information through a PC, sometimes you have to go through a firewall. Sometimes you have to enter, say, a few passwords for you to be able to look at getting access to it. So that means you would need to look at putting in some secure, looking at accessing some secure information on the server or on, for the patient records, and for which you need to go through some security access or security codes. That could be a password. That could be, for example, swiping your RFID card. In some cases, it could be information which you have to access through a VPN or a virtual private network, and that network would require additional passwords. And in some cases, like when you get into ICUs or wards and things like that, what you also have access to is you can only get in if you put in a key. There are normally latch locks on that, and you normally key in a number to get in or get access to that department, like where the medication is kept. So you have to key in some numbers and then you go in. So there are hardware, software, and also in some cases double and triple level of passwords that you have to go through before you get access to that information or access to a particular, say, medicine or something like that. Correct?
Yeah.
So that is to make you aware that in some cases the information which is considered sensitive, like for example medication for patients in particular who have had a clinical surgery or an operation or need some medication on a daily basis, that dose or that medication can only be accessed through using maybe a security fob or a card access or some password that you put in through a number lock, and that allows you to go in, get that formulation, and then administer it to the patient. And the reason why this is done is because that is considered to be sensitive, and or it could lead to some sort of a harm if it is not administered at the right time or with the right dose in terms of the proportions and the dosage. Okay.
Yeah.
Now, in correlation to that, what we look at is when we look at medics in particular and HCPs in particular drawing up care plans. There is, when the care plans are drawn up, say, for example, you've had a procedure done and now you've been released, but there would be certain amount of associated or ancillary care that you would receive for a few weeks going further. What you will need to do is there will be a prescription, for example, is a care plan which is drawn up. So you need to take these medicines, take this for this long, and then come back and get it tested. That is the condition improving. So that is a small example of a care plan. Now we call it prescription, but from a medical perspective, when you write out a prescription which is talking about you need to take these many tablets or take this and this these many times a day for these many weeks, and then you need to come back and get a checkup done, is nothing but a kind of a care plan which a doctor draws up, or a healthcare professional would draw up. So if you've had an accident, for example, and you've gone through a surgery or whatever it is, and then at some stage you need some physiotherapy. So there's a plan which is drawn up, and that plan is nothing but an essential piece of communication which happens between a healthcare professional or a doctor and between the patient or the person receiving the service. And that is nothing but also a communication, but it might be called a care plan, or it might be called a prescription, or it might be called, a medical way of saying that, okay, this is something that you need to follow for a certain number of weeks or time before you end up coming back again for a checkup.
Yep.
Okay, so care plans are important tools essentially in communication, and what they look at is we can look at different forms of plan. So even a prescription is a care plan, and that is what allows the patient to get hold of, it's an important piece of documentation which allows the patient essentially to understand what he or she needs to do or needs to take from a point of view of, maintaining fitness or, regaining fitness depending on the condition or the situation. And these communication plans or care plans are essentially documented. So you retain a copy, the pharmacy retains a copy, and the GP surgery or the hospital retains a copy. And the reason why they retain a copy, and it's sometimes done in triplicate or, they retain them, is because they want to ensure that there is a consistency in terms of communication, and that is leading to, the right quality of care in terms of the care which the patient or the person is receiving to overcome that situation or overcome that condition. So these records sometimes are, when you, what I want to do is give you an example. So for example, when you say, for example, if you go to visit, say, some of the facilities that you use within a surgery or within a hospital. Sometimes you see there's a kind of a checklist which basically says this has been updated on such and such date. It could be a basic cleaning checklist. It could be a basic checklist which basically says, okay, if there is a bed or something which is prepared to receive the patient, the oxygen cylinder has a sticker on it which says it's been checked on such and that date, the volume is such and such for oxygen. And the reasons why these are done, which are very small examples of a care plan, is because the information which is described on them is quite sensitive, and this is sensitive to the usage of the equipment when it is required to be used with patients or people who are receiving treatment. So these kind of things are important legal documents, and they are signed off on a daily basis in some cases, or signed off on a monthly, weekly, quarterly basis in some cases. And this is done because they want to make sure that the workability of that particular equipment is to a required standards to ensure quality, which is delivered in the consistency of care, or in the care which is required to be delivered to the patient. Is that okay?
Yeah.
And you will see sometimes this bit of communication is in the form of basics like some sort of a traffic light system. So red, green, and amber. Sometimes you will see check boxes, tick marks, or signs which basically say that this is something which should be easily readable, or something which is easy to interpret from a point of view of in a workplace, or in say, for example, an environment. So in hospitals, sometimes you will see a sticker which will say ban of the mobile phones are not allowed. So instead of putting a poster or a notice, what they will do is they'll just put a kind of a sign which will say fire exit, for example, or mobile phones not allowed, electronic devices not allowed, and that itself would be good enough for it to communicate a message in terms of important piece of communication, that okay, the use of such and such instruments are not allowed beyond this point in the hospital.
Yeah.
Is that something that you've seen, or in the case settings that you've seen?
Yeah.
Yeah. Now, the other aspect of things that we look at is, we look at receiving a lot of information. Sometimes you receive information in error. And in those cases, when you receive information in error, I think a common example that we get to see is when you receive emails, and in the emails, it has a disclaimer or a footer which says that, this information is only intended for such and such recipient, and if you've received that in error, then you need to inform or delete that email. Correct?
Yeah.
So when we look at dissemination of information, sometimes this information, when it is disseminated to digital means, through paper, through post, things like that, sometimes you get to see that this information can also fall into wrong hands or can be disseminated incorrectly. And in those cases, what you have is concerns of reporting which are brought in. That means if you feel that the information has not been sent across properly or has not been stored or shared properly, then you can also look at reporting this to higher authorities, or requisite people within the setup. It could be somebody who's dealing with data protection, or somebody who's dealing with handling of data. So in those cases, you look at reporting concerns in particular. Is that okay? So if a hospital has, say, records of a particular patient or the surgery, and if you say the records have gone missing, then they need to be reported, because it is not something which is usual, but it is something which is very unusual, is because those records are sensitive, and if they go missing, then they need to be reported. Like banks, for example, if we get to see this in the news quite often, is that hacking, for example, hackers come in. The NHS had their services disrupted, I think about 6 to 8 weeks back, when there was a large-scale attack on, some of the trusts, hospitals in particular, and the patient operations and procedures had to be put off because sensitive bit of information was not, accessible, or in some cases it was hacked. So in those cases, concerns have to be raised when you have to kind of, sensitivize relevant authorities about the information which has gone missing, or the information which is primarily, could have fallen or has fallen into unsafe hands. Okay. Let's look at next few slides, to look at just basically some, questions to look at. understanding what we've looked at covering so far. So what type of information do you think Data Protection Act can apply to? Spoken information? Is it information which is given out in training sessions? For example, if you had a speeding ticket, you've gone to a training session to attend training, or is it electronic files or organized paper filing systems, or is it information which does not relate to any particular identity of individuals?
The files, but would it not apply to spoken information as well?
Well, it would apply to spoken information, but from a point of view of data protection, the spoken information would be in some cases like you're having a discussion between the patient and the GP, or you're having a discussion with say for example, in the healthcare setting, you're discussing it with the patient or the person who's receiving the healthcare. It could be spoken information, but yes, if it is looked at it from a point of view of you discussing somebody else's thing, you discussing something about a person with somebody who is not concerned or related to the medication or to the treatment of that particular patient, then in those cases, even spoken information would kind of say that you're not complying with Data Protection Act.
Yeah, okay.
Okay. The other would be, say, for example, what would be your first point of call if you have concerns regarding confidentiality? Who do you kind of sensitize first if you feel that the information is not being shared or is being shared outside the remit? Would you do it with the care commission, for example, the highest authority? Would you do it with an individual in a family or a colleague, or would you go to your manager or your supervisor?
Yeah, no, you don't go to your manager or supervisor.
That's great. And the other bit is, which of the following people would be classed as authorized or authorized persons or people who are actually needing that personal information? A senior worker who is involved in supporting the individual, a member of the family, a colleague, or another worker from the care team who's providing support to an individual?
Yeah, only people that are providing support to that person need to know.
Right. Okay. So in some of these answers, can apply in different situations. For example, if you need to break a news or you share a news about a particular condition of a patient with the member of the family, then in that case, some of the other options would also apply, like B, for example, you're discussing. But in general cases, looking at the direct question and understanding that yes, it is you are dealing with the person directly, then in those cases, D would be maybe the most relevant answer. Now, let's look at briefly going to the task 1.4, which is talking about how does the structure of the organization look at different forms of communication. So if we have a setup wherein it's a small business or a small setting, and if you have a kind of a large setting which is a large organization, what are the various forms of communication which can happen? So when you look at a GP surgery, for us in that context it is a small setting, but when we look at a hospital or a trust or a number of hospitals under a particular trust, which will be a PCCT, in those cases we will look at say it will classify that as a large setting. So when we look at communication happening within these setups, we classify communications on three aspects. We will have downward communication. That means it is coming from the top management or somebody who's senior enough in the organization, like if you look at a clinical director might send out communication to some of his colleagues or doctors within the organization in a hospital. But in a surgery, this would be a managing partner, or say for example somebody who is managing the surgery, sending downward communication in terms of rules, regulation, policy, procedures, things like that, or it could be journal information. Sometimes you get to see lateral communication or horizontal communication happening, and this is communication between departments, between peers, between colleagues, but they are within the same department. So an example of that would be communication going around, sharing of records happening laterally within, say, a radiology department, or within, say, a particular department, like, say, for example, when you look at a large setup like a hospital, you're looking at information of patient records being shared within the teams, which are, amber teams. Mostly they classify them in the case of, red, green, and amber. The teams who are doing a handing, taking over in terms of shifts, they will pass on information, and that's happening at the same level. And then we look at upward communication. Now, sometimes you will see important bits of communication or information also happening from people who are in the front line, who deal with patients in the front line. So, for example, when you go into an A&E, you'll get to see somebody at the reception first, which will take down some details, and that information electronically is then passed onwards to a doctor or a medical doctor who will be primarily seeing you at some stage when your name is called. In the case of surgery, it would be things like when you go in and you register yourself, seek an appointment at the reception, but that appointment kind of travels upwards into a diary management system, wherein that communication is going to a doctor to say, okay, this and this patient would see you regarding this and this on a particular day. So within an organization and within setups that we look at, big, small, small and large setups within the, healthcare setting in particular, or the NHS in particular, we do see 3 different forms of communication happening, which is downward, horizontal and upwards. Okay.
Yeah.
Now, this is something which is a slide which basically shows, and there's no relevance to it, but just to give you an example of how sometimes you will see structures within the organization and how communications would work. So if you see something which is, a structure that I've taken here, which is from IBM in this case, and when we look at, you have somebody who's the head of the department or maybe the head of the organization, has some subordinates, and underneath that there are various departments. So a top-down communication would be from this Senior Vice President Jones happening to, across the organization, which could mean that he's sending journal, say notices, messages, things like that to everybody in the organization. Sometimes we will see information going across within a department. So for example, when we see something in the petrophysical or, production department, that flow of information within the department will be horizontal. And if there is something sensitive, say for example, if this is an example of a drilling organization, but if we see something sensitive coming across from a drilling site, then Miller, for example, would pass this information upwards, saying that, okay, there's excessive pressure building up in the place that we are doing drilling, and that needs to be looked into. So there is upward communication happening from the frontline person or person who's actually doing that job directly, and it's happening upwards to manager or, upwards to management. And that would be an example of, say, formal 3 different types of communication. Formal communication in the written form, or in the verbal form, or in, the written, non-written, verbal form happening within a structure. Sometimes you will see gossip or information, which is discussed. One such form informally will be gossip. There'll be other mediums wherein you discuss, information amongst yourselves, your colleagues, your peers, and even your superiors. But that information sometimes is not documented, and that information then also travels in different forms upwards into the organization, or stays at a certain level because it's being discussed amongst a certain number of colleagues. And in those cases, you will see different patterns of communication also happening, in some cases. So sometimes you will see that pattern being, so example, what I'm trying to say here is, when you see a professional setup and an organization, most of the communication within the organization would be done formally.
Yeah.
But if you are to meet up, for a social occasion, a lot of discussions, a lot of things that you discuss. Okay, the other day I had this patient, and this is what it was, but that is happening in a very social kind of a setting, wherein that information is just for the purposes of discussion and has no repercussion in terms of either sharing of confidential data, or and has no bearing wherein somebody would pick that information up and then use it somewhere else, because that happens in a social setup. An example here that I would say is, when you look at advertising agencies in particular, or creative agencies in particular, there the atmosphere in the organization is quite informal. So you will see that you'll have a beanbag, you'll have some cubicles, you'll have people who will be allowed to bring in certain things, and you'll have things on the desk. The way the communication happens is quite informal, and it's quite social. So there, the structure of the organization kind of influences the way the communication happens. So somebody who is maybe an executive, an account executive, might have access to the accounts director, and the communication could be quite chilled out or quite informal, in the sense they might say and not follow a very formal dictum or a procedure of having that communication within that organization. So sometimes you will see the structure and the type of organization also influences or has influences and bearing on the type of communication that organization develops. So in some cases, when you work within colleagues, or when you work as colleagues within a particular department, or you're taking care of things jointly, then you tend to develop a more informal pattern of communication rather against something which is very formal. But with your boss or your manager, your communication is still going to be formal to a certain extent, and that might not be the case when you are having that same communication with your colleague, isn't it? So sometimes what you will see is that depending on the structure of the organization, the culture of the organization, the information sharing and how it develops has a direct impact because of these two factors. Is that okay?
Yeah.
And that is what I'm trying to kind of highlight here with these two slides. Now, within the medical sector, when we look at hospitals and we look at surgeries, there is a very complex network of sharing of information. And because when we look at, for example, providing care, what we do tend to see is that the patient record kind of becomes the centerpiece which everybody has access to, because if they have to provide, basically care, they have to access that information, right? A typical example that I would do is if you have had, say, for example, an emergency and you've been asked to go to A&E, you go into A&E, the same bit of information that you kind of provide at the reception when somebody takes the basic details of your name, your date of birth and your address confirmation will also happen at some stage when you see a medical nurse. They will do some bits of checks like a blood pressure check, or your basic checks like your temperature, and she or he will also input some bits of information into the computer or maybe on a patient record. Then after that, when a doctor sees you or a medical doctor sees you, somebody who's a physician in the hospital, hospital GP, when they see you, they ask you the same set of questions which has been asked in the reception. Are you taking any medication? Do you have any allergies? They will go through that bits and pieces of information, even though they have it on the patient record, which has been documented from the time that you've come to A&E, is because they want to ensure two things. One, the consistency of information that you've shared. Second, what they want to be able to do is they want to build their prognosis or some sort of diagnosis on the bits and pieces of information that have been collected so far and have been confirmed so far at various levels. So this paper or this bit of record which is created when you go in is then shared by different people, and they make different inputs into that record, and everything is being documented. And this documentation then leads to a creation of some sort of a knowledge base, about you, or as a patient about yourself and your various conditions, or things like allergies and various bits and pieces of information. And this is accessed by each and every member of the clinical staff, doctors, whatever it is, nurses, till the time you're there in that department. Correct? Yeah. So here what you will see is, irrespective of the hierarchy, irrespective of who's senior, who's not, or who's doing what, this bit of information will go back and forth, front and forward in a crisscross fashion, and everybody will have access to it till the time they've completed that treatment or that, the particular procedure on you. Isn't it?
Yeah.
So you will see in the healthcare setting, what will happen is the information assumes multiple dimensions, and the access of this information can be done through various types of resources, or this access is granted through various mediums to various people simultaneously also. Okay, that is what I'm trying to show here is in this slide, is that sometimes the information will assume different dimension, and that would mean the information is providing knowledge, but it is also engaging, creating engagement, and also at some times it is ensuring safety, and it is also being updated. So there are 4 things happening on that information at any given point in time when you're in the hospital or within a particular setting.
Yeah.
Right? Okay, good. Now let's look at some barriers. What do we classify as barriers in terms of when we don't get to see, if somebody said something, you don't get to receive the information. Why do you see there are barriers which come in, or obstructions which come in primarily when we look at information flowing within organization. So here there are different barriers that I've listed out. One is interpersonal barriers. Now these barriers could be interpersonal, and they could also kind of block out certain pieces of information that you're trying to access or you're trying to receive. Sometimes authority, which we discussed earlier, you might not have the access to that information is because it's on a need to know basis, or it's on a basis of people who need to have access to that information.
Yeah.
Right? Sometimes you have no access to the information because it's not related to the task that you're doing.
Yep.
Sometimes it could be political, which is within organization, we see a lot of politics. We do see a lot of, operational workings within colleagues. And because of it, sometimes you don't get the information related to you on time. You get it, but you get it later because of the fact that, it's been influenced by political factors. It could be also related to identity. And we've also discussed with regards to identity and authority would go hand in hand to a certain extent. But in some cases, if you do not have access to it, it could be because you do not have the right identity access for it, because it's password secured, or it is, dependent on the hierarchy in which you're trying to access the information.
Yeah.
And then organizational culture and organizational, structure also kind of create barriers sometimes, because you will not probably see all bits and pieces of information reaching you, because you're in a particular type of culture wherein the information is kept sensitive, secretive, and in some cases it takes a lot of time to reach you because the organization has a matrix or a hierarchical structure. Okay. Now, next slides are typically looking at how do you look at feedback going upwards, because it's important. People who work within frontline services within this sector need to make sure that the certain amounts of information is, communicated upwards for improvement in terms of quality of care, consistency, even to regulate safety or to avoid any accidents which could happen because of that sensitive information not reaching upwards in time, which affects decision making.
Oh, sorry, excuse me.
No problem. So sometimes you get to see that this will happen when bits and pieces of information is to be communicated upwards, which help in improvement of processes, policies, consistency of care, and even quality of care which is delivered to patients within the healthcare setting. Okay.
Sorry.
And then we look at some ways through which we can improve this communication. In some organizations, you will see there's an open door policy. There is a phrase that you would have come across, or you have access to the top management. These are phrases that we look at when we look at, communication happening within an organization. All channels of communication are open door policy, easy access to your boss or your line manager. There are policies in place to look after grievances, misconduct. Regular meetings are done. There is a dissemination of information which happens even if you've not attended the meeting. You still end up getting the minutes of the meeting through an email or through a document that you're expected to go through. CPD, even trainings which are happening. For example, when we look at health and safety or new equipment being introduced within the setting, then everybody who will need access to that equipment will get training on it, and that kind of promotes communication in general, both upwards and downwards within the organization. Okay.
Yep.
So these slides basically, how do we improve communication? So it could be that when you look at a large setup, what tends to happen is in large businesses, large organizations, you will get to see that there is a communication manager's post, or there is a medium which is created through which important pieces of legislation, changes in that legislation, or policies and procedures are regularly published onto notice boards. There are committees which are formed or structures which work wherein people are invited to become informally part of structures or form committees to have discussions and put forward points or suggestions for improvement. Mm-hmm. In most organizations, you see something called a suggestion box, correct?
Sorry, I was just writing. Yeah, yep.
So for example, when you go to a surgery, do you see a suggestion box? Or have you come across a suggestion box in a surgery?
Yeah, you put in your changes and your thoughts and things.
That's correct. So basically, there are mediums through which the organizations also invite feedback, and this is feedback coming in the form of communication happening externally from the people who use the products and services of that organization, say a GP surgery, say a hospital. So they always ask you to fill, say, a survey or a questionnaire in most cases, that how was your treatment, did you receive the treatment, it would have various questions on it. But this type of feedback, which is looked at from getting from external sources in some organizations, is very vital, because it gives them a perspective of understanding how do people receiving the care perceive that quality, or perceive the care which has been delivered from an external point of view. So you will see that communication happens within the organization at various levels, upwards, downwards, horizontal. But in some cases, what we also look at is we look at developing this horizontal communication and gather feedback from external factors or people who are actually using the products and services. And that also helps overall to improve communication happening within the department or a setup. Yep. Is that okay? Now, that's what this particular slide emphasizes. Is sometimes what you look at is, you look at gathering pieces of information. It could be, looking at providing physical means through which, for example, you will end up giving or administrating a questionnaire or a survey. Sometimes you receive that on an email. Sometimes it is, when you are having a round from a doctor within the ward, he or she might come in and say, okay, are you feeling okay? Are you comfortable enough? Those are informal ways and means to gather feedback, which is done. And that also helps in, improving the quality of care which is delivered. And obviously, in general, it provides indirect signals to the practicing nurse or the person administrating, the service to the patient, getting a hint that, okay, the patient has reacted, no, I'm okay, but, I've had this problem, that problem. That means he's not been taken care of properly overnight, or the shift, the person's responsible working in the overnight shift probably did not end up doing the task. But this is not documented, but this is informal feedback being captured, and at some stage also helps in improving, workings in particular within a setup. Yeah. And then the last slide that we are looking at is basically talking about, the richness of media and how sometimes we look at different, equipment nowadays, or different mediums through which, the communication happens within organizations. Now, this in general as a matrix can apply to any setup. So when we look at media, we look at face-to-face, we look at telephone, documents, oral and verbal. When we look at, what type of characteristics or clues this particular communication provides, face-to-face, if you're able to meet with somebody, have a discussion, more or less you get, the communication, which is more or less very direct. So if you come in and see a GP in the surgery and you describe the problem, he or she is able to accurately diagnose it, and then you get a prescription and you get an outcome pretty much immediately. If you're having it on a telephone, sometimes you end up calling the doctor, the surgery, and say, okay, my son's not well, and he's showing these symptoms, what is to be done? In those cases, they will say, okay, do this, do that. If it does not improve, you bring him to the surgery. So the idea of having this matrix is to understand how sometimes you will communicate and what channels you would use. And when you use these channels, how quick is the feedback which comes to you in terms of, the response. And last but not the least, in certain mediums, if the information is not given out very clearly, and, let's put it this way, in a very transparent clinical fashion, then sometimes the information on the other side could also be interpreted ambiguously. So in order to remove ambiguity in the information being, transmitted within the organization, what we look at is we sometimes pick up a media or choose a media for communication because we want to elicit or get a particular type of response. So if you want a quick response, you go and have that discussion with the person face to face. If it is not immediate and not urgent, you might do a postal, feedback, or you might drop something in the post and say, okay, it'll come back and you need to finish this and complete it and send it back in the next 2 to 3 weeks. So those kind of things have to be looked at sometimes when you look at the how information is received, processed, and then disseminated within the organization, and the channel and the mediums of dissemination depend on how important and how urgent is that piece of communication or that piece of data information which needs to be relayed or transmitted. Is that okay? Is that okay?
Yeah, sorry, yes.
Okay, good stuff, no problem. So any questions on this so far?
So I think this you put this slide up on Moodle already, because I flicked through it. I went through it while I was at work.
Right, okay.
Yeah, very familiar. I'm sure it is, because it seems quite familiar.
Right, okay. That's fine. I think I'm just going to quickly look at Moodle as well, open this up and see, because I think for the first, that we're doing the people management in particular, what I've done is, I had put up all the presentations which should be accessible to you from Moodle. So we've done it from a learning outcome perspective. Yeah. And for learning outcome one, I put, I think 2 down. So the one that we covered last time, and this is the one which covers task 1.3 and 1.4. And then we have the learning outcome 2 that we're going to try and discuss in the next session, which will be teamwork, and looking at basically team building, teamwork, and why teams are important. We'll have some correlation to leadership styles and management styles within organizations that we need to look at. And then there is one other presentation which I think I put together would be relating to learning outcome 2, which is looking at workplace practices in particular, and that will be learning outcome 5. So we've got, this particular unit pretty much, is about understanding how people work within organizations. And the idea is to look at contextualizing it slightly, because this is a common management unit, but we need to look at contextualizing it from a point of view of the healthcare settings in particular.
Yeah.
Okay, brilliant. So what I'm going to do is, with regards to the presentation, which is already there, I'm going to send you a bit of a handout on this, a couple of pages for you to read through, 5 to 10 pages, which will cover directly the tasks that we've discussed, 1.3 and 1.4 today.
Yeah.
Okay, so that will be a bit of write-up. So it's trying to look at, giving you now a bit more detail onto the discussions that we've done through the PowerPoint slides.
Yeah.
Fine?
Yes, that's fine.
Now, how's your availability in terms of your rota, in terms of your working for next 2 or 3 weeks?
This week was only the person I work for. She called me in to train someone, because obviously for Wednesday I was supposed to be off. And that person now hopefully she won't call on me again. She knows that I have my lessons. So next week I'm working. However, if we need to kind of catch up on Monday when I get to my boss's, because when I did my MVQ level 3, he was quite happy to, work around that as well. So I can speak to him and ask him if I can have a lesson next week. But that is my working week. The week after that, I'm completely off, and so on and so forth. It's week on, week off.
Right, okay, that's fine. So if you come back to me, I'm looking at my calendar. Obviously, I can look at the first is, obviously, which is the Wednesday next week, is relatively free. And that is something that we can do a session on if that is you're available. Otherwise, I can slot something in for even Tuesday in the afternoon, and then maybe, so I think Tuesday, Wednesday, Thursday afternoon timings, there would be a possibility for us to slot something in terms of a session for this unit.
For next week? Next week,
yeah, which is starting 30th.
I'll text him now when we're finished, and I'll ask him if there's a slot, an hour that maybe I can do with you, that he knows, because sometimes he likes to watch snooker and he knows he's going to be at home all day. Sure. So then if he's at home all day, then I will have quite a lot of time to be able to do kind of my own thing. So I'll text and ask him if there's like an hour I can do between Tuesday and Thursday, and see what he comes back with. And then I can email you that, and I'll email you the rest of my rota.
Yeah, that sounds good. So basically, if you text me, what I'll do is, or you email me in terms of availability, if you can put in 1 or 2 times, then what I can do is I can then send out an invite to you for that session, and then the subsequent week also, if you have some dates available, just give me some ideas so that I can slot the next 2 sessions in, and then we'll try and see if we can keep these sessions like we've done today. It's exceeded an hour, but it's good because I think we've been able to have a good discussion on at least the coverage that we want to do, and if required, the next 2 sessions could be the same, so that which will help us in terms of kind of boxing up this unit and the learning outcomes. The next 2-3 learning outcomes in this unit are going to be quite interactive because it all revolves around understanding how you work within teams within an organization. So like you're working with your manager, like you're working with colleagues within the work that you do, it'll be easy for you to be able to relate how team working and how team building and how these kind of things work together. So it's going to be interactive, but yes, these are going to be brief sessions, and we'll be able to cover more ground as far as the learning outcomes are concerned.
Brilliant, brilliant.
Good stuff. So let me send that handout to you in a couple of minutes, and then I will, obviously, hopefully, once you communicate back to me via text or an email, then we'll plan the next session.
Yeah, I will send him a message now.
That's great. Thanks a lot for